Training India's quacks. Should fake doctors be given a chance to fill the real shortfall of physicians in India? Also on today's program, the dangers of Daesh recruitment. We speak to the mother of a young man who went to fight for the group in Syria. And picture this, celebrating the indigenous cultures of the Americas on the anniversary of Christopher Columbus's arrival in 1492. Hello and welcome to the Newsmakers with me, Andrea Sankey. Now, India is facing a major challenge when it comes to providing health care for its population of more than 1 billion people. While the big cities may have world-class hospitals, their cost is prohibitive for most people, and there's also a huge shortage of qualified doctors. It means that many people in India, especially in rural areas, rely on what are known as quacks, people with no formal medical training who nevertheless prescribe drugs and give medical advice. While their skills may be unreliable, one charity in Kolkata believes the experience of these quacks can still be harnessed to make up for the shortfall in physicians. Our newsmaker today is India's quacks. Could they provide a realistic solution to a genuine healthcare problem, or do they undermine the medical establishment and pose a danger to patients?
India has a chronic problem. There aren't enough doctors to meet the needs of the population. It's estimated there are less than 1 million of them to serve more than 1 billion people. And unqualified doctors, or quacks, have stepped in to diagnose and treat patients. A quack is a person who dishonestly pretends to have medical skills or knowledge. The World Health Organization found almost a third of practitioners who prescribe medicine in India had only been to high school, and almost 60% did not have a formal medical qualification. Some of these self-declared doctors prescribe antibiotics and perform procedures, even though what they're doing is illegal and can be dangerous. The doctor shortage in rural India is acute. Up to 75% of medical visits in those areas are made to unqualified doctors. So medical charity, the Liver Foundation, is now training some of those quacks so they can provide limited health services. A review of those efforts in the journal Science found that the training may offer an effective short-run strategy to improved healthcare provision. But is that training ultimately going to lead to better health for rural Indians, or will it simply mask the problem of a lack of access to qualified healthcare? Natalie Pohanen, The Newsmakers.
Well, joining me now from New Delhi is Dr. Ajay Gambhir. He is a member of the Delhi Medical Council. And from Washington, D.C., I'm joined by Jishnu Das. He's a lead economist at the World Bank and senior visiting fellow at the Center for Policy Research in New Delhi. He was also the lead author of the Science Journal review that we just heard about in Natalie's report. Thanks both so much for joining us. Dr. Gambhir, let me start with you. Given your organization has actually taken action against them, tell us how dangerous these quack doctors really are.
The quacks are very dangerous, but definitely how do you define quacks? There are the people who do not pose any degree. So they do not pose any skills, they do not pose any trainings. So those quacks are threat to the society and have caused disasters. Even they have gone for medical termination of pregnancy and abortions, which has killed a lot of patients, especially in cities and mega cities where the urban health is totally in shambles. So we are talking about two types of people who are not at all qualified and who are qualified under other things like Ayurveda, homeopathy, and Siddha. So we can call alternative system of medicines. So there are two types of persons which are doing that.
Okay.
And once we cross our borders, and they are definitely...
Okay, Jishnu Das, though, you say you found evidence that actually shows otherwise, that these doctors without degrees can actually serve a very useful purpose when given training.
Oh, absolutely. I mean, I think part of the problem has been that we have a lot of beliefs about what quacks or informal providers, as we prefer to call them, are doing, but we have very, very little evidence. So one of the very surprising things that we found in a previous study, which led us to believe that training would help, was when we sent patients into the public sector and to these informal providers, we found that they were receiving an equivalent quality of care in both these places. So the reason why poor people and why people in rural areas in India were visiting these informal providers, and let's get an idea about the scale of the problem. In the northern states of India, about 80% of all primary care visits are to informal providers. They're visiting them because either they don't have an option or because of the quality of care that they can get in the other places they could go to is roughly the same. So our thought was, and the Liver Foundation's approach is, in villages where people have no other options, where these are really your best bet, can we actually do something that would improve the quality of care that the poor get, rather than taking a stance that says, let's get rid of these guys, leaving poor people with absolutely nothing?
So, Dr. Gambhir, I mean, is your organization suggesting any real alternatives? Because it seems, in a sense, that some of these so-called quack doctors are actually being blamed for what is really the failure of the Indian state itself to provide health care for millions of people.
I totally agree with Dr. Das, though there are issues of availability, accessibility and affordability, we definitely call them, and India has one of the poorest ratio of the doctors-patient ratio, and definitely once there are gaps, so someone is going to fill it up. Now the issue is, are there people sufficient who are filling it up? So definitely we are acting on behalf of the Delhi government and the High Court and the Supreme Court orders that these quacks have to be checked. I'm not debating Dr. Das thinks that some of the quacks or some of the unqualified people may be giving same satisfaction or may in quality as far as primary care is concerned. So that is not a debate. I totally agree, because I'm a pediatrician and working with different organizations, A&M, ASHAs, and some of these people have been used in periphery to implement the primary health care as far as the neonatal and maternal services are concerned. But that means they have to get registered. So the first thing is to make a council for them, make them registered. And in India, there is no registry for the quacks. There is registry for the Ayurveda doctor, there is registry for the MBBS doctor, allopathic doctor, and there is registry for Unanis and homeopathic doctor. But so I agree that some of these quacks in periphery can be used as health worker, as a peripheral health worker, and also their mandate has to be restricted.
Okay, then Jishnu Das, it almost sounds like he's only speaking about a technicality that could rather easily be rectified if you can establish a proper registry.
Oh, absolutely. I mean, I think, I think on the ground, what we actually see is that the informal providers have associations and they're in direct contact with the public health officials. So, for example, in Birbhum, where we did our study, there's a big association of informal providers called the Birbhum Rural Health Awareness Association, and they're in direct contact with all the public health officials. And in fact, the public health officials use them. I work on tuberculosis in Mumbai, which is a huge problem. And I was really surprised when I go into the slums and I go into the hospitals next to the slums, the guys at the hospitals are very, very clear that they are in direct contact with these informal providers who actually encourage the patients to go to the hospital, who make sure that the treatments are going well. So I completely agree with Dr. Gambhir that, look, at the local or even at the state level, there is a very deep contact and a connection between the government and the informal providers, and the government realizes they can't work without them and they use them. At the national or the state level, do we have a registry yet of these informal providers, and what would such a registry do? That's still uncertain and something I think is worth thinking about and moving on.
Okay, so Dr. Gambhir, I mean, you complain about these doctors having no formal degree, but would your association at least settle for some minimal training?
No, we are not. We are following the orders given by Supreme Court of India and even High Court of Delhi to check some of these quacks. The quacks means the people who are not qualified and trained. Now, I am telling, some of the people are not even metric pass. I agree with Dr. Das. They are close to the community. They are in touch with the community. Social and other factors may be nice. But technically, in mega city like Delhi, if you have a medical termination of pregnancy, you have a death from an operation done by a quack. So this is unpardonable in the modern times when India is progressing. So there is a place where there is a doctor and where there is not a doctor. Then they should not be known as quacks. They should be known as health worker or health assistant or community health worker or something like that. So we cannot say the quacks. Quacks means, Oxford Dictionary says quacks is much more than what I am doing.
Okay.
So
It
that
sounds
is
like
what
you're talking
we are
about.
very clear about that. Who is quack and who is health worker?
Right. It sounds like you're talking about, in a sense, people that are genuine frauds, dangerous frauds. But Jishnu, let me pose this to you. Some have said that you create a risk here by encouraging more quack doctors to get fake certificates and then legitimize this illegal activity. Do you worry about that?
So here's my sense, which is, yes, there might be severely illegal practices, and Dr. Gambhir brings up medical terminations of pregnancies that are illegal and can endanger the mother enormously. And I completely agree that if somebody is, engaging in practices that are illegal and deeply harmful, they should be checked by the legal system. What I find fairly interesting is I think Dr. Gambhir and I agree on a number of things, which is we shouldn't call them quacks anymore. We should, we prefer the terminology informal providers. And when it comes to the technical quality of care that they provide, at least in the primary setting, we find that the technical quality of care that they provide is quite equivalent to what we find in the public sector. In fact, in our study, we found that the fully trained doctors were much more likely to give antibiotics and unnecessary medicines than the so-called quacks. Now, this deep question that you asked, Andrea, about what happens when we give them training, does it legitimize them further in the eyes of the population? I think the Liver Foundation's been very clear on that. They start off the training by saying, look, you are not doctors. The training is not going to make you a doctor, and we're not going to give you a certificate that allows you to prove to people who may not know better that you're some kind of doctor. And in fact, when we visited, I personally visited about 70 or 80 of the clinics over the years that we were doing this study. Not one of them had a certificate from the Liver Foundation that they had purchased illegally or made illegally. At the same time, the training helped, right? I mean, these are poor people. They don't have anywhere else to go.
Okay.
And I don't really see the problem with, if they're providing better care, let's do it.
Okay. Jishnu, our window is closing. Dr. Gambhir, I'd just like to get quick final words from you.
I think it's a much more complex, and definitely if availability, accessibility, affordability goes, we have seen in Delhi wherever the qualified doctor comes, the unqualified doctor's quack goes away. So I think if we fill the gap, if the doctors are ready to go to the rural area and qualified doctor is there, the quack vanishes.
Okay.
So I will definitely put my say and under the Drug Act. So under the Drug Act also, the no quack can use a drug. But India, the drugs are available anyway, even chemists are using the drugs. So I will say put qualified doctors, give them trained, make them registry, and use some of them in the primary health care, maybe transfer of the newborn baby, single use of gentamicin. We can definitely use it, but in the periphery only.
Okay, Dr. Ajay Gambhir and Jishnu Das, I'd like to thank you both so much for joining us on the Newsmakers. Still to come on the Newsmakers, how does Daesh target young recruits in the West? We hear the story of one woman whose son died fighting for Daesh in Syria. And in Picture This, on the day Christopher Columbus discovered the Americas in 1492, thousands across the continents celebrate the people and cultures who were there long before he arrived. How does Daesh target, radicalize, and recruit young people from wealthy Western countries? It's a crucial security issue that many governments are grappling with. But on the individual level, it's also an issue that has devastated families. In a moment, we'll hear from a Canadian woman whose son went to fight for Daesh in Syria and died there. But first, this report from Yvette McCullough on the scale of the problem.
Daesh, the self-proclaimed Islamic State, a terrorist group with international appeal that's using social media and online propaganda to radicalise and recruit thousands of fighters from across the world to join its war in Syria, Iraq and Libya. Its main target, disaffected and alienated youth looking for a cause. It's estimated between 27 and 31,000 people have travelled to Syria and Iraq to join Daesh and other groups. The so-called foreign fighters come from at least 86 countries. Around 5,000 of them are from Western Europe and 280 from North America. The average rate of returnees to Western countries is around 20 to 30%, presenting a huge challenge for governments on how to de-radicalise and reintegrate them into society and monitor the potential terrorist risk they pose. But for the families of those who go to fight, the concern is more personal and painful.
His radicalization was very, very fast. In 3 months, he started to pray, he chanted, and then he left for Syria. We were very surprised in the family because we didn't saw signs.
The families of young Daesh recruits often have no idea their son or daughter has become involved with the group until he or she leaves for Syria or Iraq, or sometimes until they receive a message telling them their child died fighting for Daesh. Many grieving families are now fighting back, asking the authorities to do more to intervene and protect. In France, families of those fighting for Daesh have helped start a government campaign countering the terror group's narrative. It dismisses the group's online propaganda, showing that the heroic life it promises to recruits is a lie. For some, the focus is on offering support networks to families who find themselves in the same position, and to help them see the warning signs and step in before it's too late. Yvette McCullough, The Newsmakers.
Well, Christiane Boudreau joins me now from France. She is the co-founder of Mothers for Life, a global network of mothers who have lost their children to radicalization. Christiane, thanks so much for joining us. First, tell me how your son, Damien, came to be radicalized where you were in Calgary, Canada.
Well, that was a good question in itself. I mean, we figured being in Canada, we're immune to anything along the lines of war, or it's not something that we understand, the violence, or that we're told to understand, being in Canada, being a peaceful country, or so we thought. In actual fact, there are a lot of these small groups coming together in Canada. It's just very much hidden and wasn't out on the forefront to many of us.
Now, he had suffered from severe depression before he found religion. You were happy, you said, when he first converted to Islam. It gave him purpose. It seemed to drag him out of his depression. But then it seemed like these recruiters recognized that he was in a mentally vulnerable state. Is that indeed what happened?
I think that's partly it. When he came out of the depression, the religion did help him. The faith did ground him. It gave him a new chance at life, new hope. But with that also came the emotional unrest that he still had with some unresolved issues. And they saw that in him, the vulnerability, wanting to protect, wanting to do something productive with his life, wanting to be a strong person and represent women and children. That was his big weakness in some ways and strength in another. And that's what they preyed upon. They used that to lure him into the group, to protect women and children that they said Bashar al-Assad was torturing and killing.
Did you know later, or did you discover later, how much maybe social media actually played a role in getting to your son and radicalizing Damien?
In Damien's particular case, it was mostly that sense of group and community that he had with the other young members in his youth group. within Calgary. They were a small group that lived in the same apartment building. But the social media aspect and the internet were a lot of the reinforcement, the videos, the literature, everything that he was directed to by the various people that were steering him in that direction to reinforce those ideas.
Now, Christian, you've said that Canadian authorities, you later discovered, were actually tracking your son for years before he was killed in Syria. Why didn't they inform you?
That's a very good question. They were tracking him for almost 2 years. The group that he was with, the other individuals that also left and were eventually killed overseas. And not once did they come forward. Now, my understanding from them was that Canada had an image to protect, and they didn't want it to get out there. They didn't want it to be out in public. So it gave us no tools, no opportunity to fight back or to intervene in any way, shape, or form. Nor did we have anywhere to turn. Once we didn't find out what was happening, it was too late. He had already gone overseas.
So you went on to start an organization to give other mothers and families the support that you didn't get. Tell us how that's working.
That's exactly it. So basically what happened was I met Daniel Kuhler, who is the director of GERDS in Germany. And I learned and adopted a lot of his methodologies. He did some caseworker training, and we formed a partnership. And we decided to launch Mothers for Life. And this is where not just mothers, we do have other family members as well. They come together, reach out for support and understanding, a place where you can share memories of your child without that judgment and that stigma placed on you. And at the same time, to take that internal grief, if they want to, and turn it into some sort of positive motivation. In other countries that we have that are part of our organization, they have their own respective organizations where they reach out. We do prevention, intervention, grief support, everything that we can to try to campaign to stop youth from joining these types of organizations.
And can you feel it making a difference?
We've had some people, some families tell us that it has made a difference, and that's all we can count on. One person at a time, one family at a time. It's worth it. Any life that we can save, it's worth it.
What about getting help and support from the state itself? Has the Canadian government, in your case, responded well to your efforts?
Absolutely not. Unfortunately, the Canadian government's the only one that hasn't. We've had a lot of support from a lot of other governments in all the other countries. Unfortunately, Canada, that wasn't the case. So it makes it much easier for me to work here in France, to push our efforts here, as Canada is very reluctant to still come forth and admit that they need to start doing some work in this space.
Christian, why do you think that is?
Again, I think they have a hard time with the image that they try to portray, that Canada's a peaceful country, that everything's perfect. And again, you've got the U.S. right on the border, and they don't want to appear weak. Whatever the case may be, they've struggled with some programs that they've tried to launch. Nothing's come to fruition. They're really not helping the families or stepping forward. Don't have any direction as of yet. So we'll see if they ever come together at one point or another. But until then, I might as well make the best of our efforts and keep working with the families that we can and keep working towards saving those youth that we can save for now.
Christian, one final question. If you knew then what you know now, if you think you'd been able to recognize the signs, do you believe you could have stopped your son from going to Syria?
Absolutely do. Unfortunately, hindsight's 2020. I learned a lot over the years, and a lot of research, a lot of studying, and I understand a lot more what his emotional motivations were and what I could have done to help intervene. It's a little too late, but it's not too late for other families, and if we can help them, that's what counts right now.
Okay, Christian Boudreau, we're going to leave it there. Thank you so much for joining us on the Newsmakers. October 12th, 1492 was the day the explorer Christopher Columbus became the first European to arrive in the Americas. But while Columbus Day is marked in the U.S. and elsewhere, many Latin American countries use the anniversary to highlight the people and cultures who were there long before Columbus arrived. We'll leave you with these pictures of the Indigenous celebrations.